Me. Great to see everyone. I'm James Dudley. I lead on communications for Thrive London. Just for those sort of coming through who may be not as familiar, Thrive London, we're a public mental health partnership here in the capital, sort of jointly funded across from the Mayor of London's office, NHS in London, and London boroughs themselves contributing towards the partnership, particularly looking at mental health and well-being, but particularly from a sort of health inequalities angle. So looking at all those things around us that influence our ability to have good mental health and thrive. But delighted today to be joined by Dr. Nicola Lester and Vicky and the team to talk through all things trauma-informed practice, really. But anyway, without further ado, I'm really excited. I'm really pleased. I'll add Nikki as a spotlight just there. Hopefully that's worked for everyone as well. Yeah, to be joined by yourself, Nikki, this morning. We've been working together really now for a number of years, actually, on various projects. And I think probably now on the back of last week's launch, really good opportunity just to chat a bit further around some of that work, some of what you've been up to in terms of development around that. And then also just an opportunity for people here today to ask any questions or raise any issues. So without further ado, Nikki, maybe best if you don't mind introducing yourself and telling us a little bit about background and your work in this space.
Thank you very much. Yeah, and it's wonderful to be here, and thank you for joining us this morning. So my name is Nicola Lester. I am a mental health nurse by background, specialising in working with psychological trauma and supporting organisations in the UK and overseas to develop trauma-informed approaches to practice. Predominantly, that's been about working in response to crises. And that looks different depending on the organisation and the context in which they're working. And over the past 10 years or so, at specialising in working with traumatic bereavement. So the new module is very close to my heart in terms of being able to develop that into a training package and make it accessible to everybody.
Brilliant. No, thanks, Nikki. And maybe that's a really good segue, actually. So hopefully people may have spotted, or maybe even, as I say, already taken that new family liaison trauma-informed training module, which we only launched last week. It coincided with Children's Mental Health Awareness Week, which was great as part of that broader training offer. I mean, maybe let's start by maybe introducing that a bit more and maybe telling us briefly about how that sort of came about.
Yeah, so essentially the new module is focused on responding to traumatic bereavement, but thinking about the role that we can take in liaising with families. And so really this training is for anyone who's in a role which could mean that they come into contact with children, young people and their families who've experienced a sudden bereavement. And the main aim of the module is to give a framework for that engagement and to provide practitioners with the skills and, I would say, perhaps most importantly, the confidence to enable them to engage with bereaved families who've been impacted by a sudden death. And it also aims to give a kind of blueprint for best practice around death notification onwards. So recognising that the people that will access this module will not all necessarily be in roles where they're delivering a death notification or even having a formal kind of family liaison role. But it's for anyone who may come into contact with somebody who's traumatically bereaved at various points within the process that follows, and thinking about what their support needs might be, but also what their advocacy needs might be as well. As part of this module, we've also developed a range of other resources. The kind of main new resource that's been added is some specialist guidance for educators and educational settings to support their response to a traumatic bereavement within their educational community. And these are evidence-based guidelines which are very much about supporting organisations in the immediate aftermath. And this is something that we know, unfortunately, is very much needed. We don't need to look very far, either in the UK or overseas, over the past couple of weeks, to think about the absolute huge challenge that educators in those settings will be facing following the deaths of school-age children. So this is something in particular that we would really welcome any feedback on for anyone working in an educational setting. If you have any feedback, we'd really welcome hearing that, so we can continue to develop these resources in particular. And in terms of how this training has come about, it's really come about from my experiences back in 2012 working with bereaved military families, and later the findings of my doctoral research, which focused specifically on exploring how the military's response impacted bereaved military families who lost a loved one whilst they were serving in Iraq and Afghanistan. And then since then, I've gone on to work with traumatic bereavement in various different consultancy roles, including a global private security company in response to deaths in hostile environments, and also for a national road safety charity, which provides support to bereaved families. And so what I found was that in each of these roles, I was using the findings of my research to make recommendations for best practice, to also inform my own practice, and subsequently received quite a lot of requests for training. And so the ability to develop another on-demand module building on that positive response that we've had already from the Gift of Reconnection is really wonderful, to be able to make sure that this training is accessible to all practitioners. Again, I would say, as I said at the beginning, this is something that's very close to my heart. And on a very kind of personal note, as a researcher, for anyone who does research, when you're working with research participants who are volunteering their time and volunteering to share some of the most incredibly difficult experiences of their lives, it feels really important and an absolute privilege to be able to feed back to my research participants that their engagement in the research will have a direct impact on practice, not only my own, but also other people as they engage with the training.
Yeah, thanks, Nikki. And I think that came through in the. I mean, obviously, I've sort of sat through and as part of that launch last week and sort of participated in the training myself. And I think some of that, those stories that you bring from your own experience in working in that role, but seeing how that is actually important for others who may just come into contact more generally. And I suppose you've kind of answered it already to some extent, but I guess, why is this training important? Well, I think there sounds like, from what you're saying, there's a little bit of a gap in terms of people wanting this type of framework and approach.
Yeah, very much so. I think not only a gap, but we're also hearing a lot from practitioners who perhaps don't work routinely with traumatic bereavement. Perhaps they work in youth or community or sports programs, and then they will encounter a young person or a family who experiences a traumatic bereavement, and they describe feeling that they don't know what to say or what to do. And so often they don't say or do anything because they don't want to get it wrong. And so, in addition to those professionals and practitioners that have a role working with traumatic bereavement, we also know that there's a huge group of practitioners that will come into contact with bereavements in some form or another, will already have relationships with families prior to a bereavement. And so this is about upskilling them, and again, more importantly, giving them the confidence to have conversations and to engage with people who are traumatically bereaved. And I think there is a real gap in terms of frameworks for best practice around traumatic bereavement. We have a lot of outdated theories of loss, which focus on things like stages of grief, thinking about how people get to these magical places of closure or acceptance. And so what we want to do here is to introduce the idea that grief isn't something to be got rid of, but rather, as psychotherapist Megan Devine tells us, it's something that has to be carried, because ultimately grief is an expression of love. And so one of the most disrespectful things that we can do when someone's grieving is to talk about them getting over it or reaching acceptance or closure. And so the training isn't just about the kind of pragmatic, how do we engage with someone, but it's about developing some broader awareness about grief, because it's something that is still very much a taboo in our society. We don't routinely talk about death or dying or loss. And that means that when we're faced with it, we often avoid or just don't feel confident to use skills to engage with people. And of course, when someone's grieving, they're already isolated and disconnected. And so us being able to stay present, to witness, to accept however we're finding people, and that commitment to engage with them and to really seek to understand those experiences becomes so important. And I really hope that that's what the training will give people, is that reassurance and that confidence that they can have these conversations, that they can stay present with someone when they've experienced a traumatic bereavement.
Yeah, and I think that's really key to some extent, is that point you're making around, actually, if you are in this role formally, professionally, and you're doing this sort of more regularly, actually the training is here, and it sort of provides those sort of key skills. But actually, we know now, we just know that so many more people are having to support in that capacity, particularly maybe in the education sector, where more demands are sort of being asked upon people's roles and specifics within a school setting or education setting. So actually, this is kind of a training that sort of anyone could come to it, whether they've already got a little bit of skill in that or knowledge in that, or actually more generally, actually more people across an organisation taking this training would find the benefit, I think, across the whole workplace in that sense.
I mean, I guess it's worth acknowledging that really one of the biggest challenges of any kind of e-learning or on-demand modules is that I do lose that direct connection with those who are accessing the training. So I guess it's just about reiterating that if anyone's doing the training and they have questions, they want to give feedback, or there's a point within it that they'd like to discuss, you know, I'm always very happy to hear that feedback and have contact from people who are accessing the training. And I think as part of the evaluation process, we're also asking participants with experience of being in that family liaison role if they would be happy to be contacted to talk about those experiences going forward, so that we can continue to learn and contribute to knowledge in this area. One of the things that comes up time and time again whenever I'm delivering this training is that those who have experience of family liaison want to share those experiences and almost use the training as a space to reflect on those experiences as well, and make sense of them, and draw out areas of good practice, areas of practice which need development. And so, as with the other Gift of Reconnection training modules, you'll notice that there's some facilitation notes. And part of the facilitation notes is about encouraging any organisation that chooses to deliver it themselves using the recording to pause at each of the principles, to take a moment to reflect on and share some of those experiences, and to use that kind of storytelling methodology to draw out some of those experiences. So whilst there's additional support available, it's also about organisations facilitating it for themselves and using the training as a prompt to reflect on some of those experiences, because I would say that's where the richest learning is going to come from. I know certainly when I've delivered training in the past, and I'm perhaps delivering training to a group of police officers who are trained as family liaison officers, and one of them says something like, when they share an experience that they've had before and they reflect openly on perhaps they could have done it differently, I know then that the training has done what I've intended it to do, which is to ask them to think about their practice and to think about and hold the perspective of the bereaved family, and to think about what else could be done differently. So whilst there is more information and more support out there, and we're very keen to continue to develop this area, we would also encourage organisations and practitioners to look inward and think about what other resources they can tap into within their own organisations as well.
No, brilliant. I think really good advice. And actually, I think we've seen that to some extent with the Gift of Reconnection series more generally, particularly again with schools where individuals may do that training themselves, but then actually come back together as a group or as a department, or as a cohort, really, to sort of sit and do it again or pick up on certain aspects. And that's probably quite a powerful way of also making people, maybe helping people feel less isolated in these roles, particularly with family liaison. Nikki, would you say?
Yeah, definitely. And I think, again, it's something, if you're not in an organisation that routinely does family liaison, that's an accepted part of the role, when you step into those roles, it can feel really isolated. And I think even knowing that other people within your organisation have an understanding of that role, even if they don't want to do that role themselves, even if they're not volunteering to take on that duty, I think it forms peer support, which becomes really important across organisations. And this is certainly the case when I think about my work in hostile environments, when they have a sudden traumatic loss, and one person perhaps steps up to do the notification and to liaise with the family. What they most need around them is their work colleagues who have an understanding of that role, even though they're not directly involved. But what we know is that this is it's a huge privilege to work with a family following a traumatic bereavement, but it comes at a cost to ourselves as well. And so the more support that we can put around that, the better.
Yeah, it's a really important point, actually. I thought the ending of this particular training module was quite powerful, actually, in how you've talked through that, how it's actually a privilege to bear that witness, but also actually the important message within that is also taking time to look after ourselves in that role. And I think there's plenty of places and hopefully support maybe within an organisation, or in terms of where people can go more generally for that help that they might need. But actually having that awareness across an organisation of how to deal or respond or support in this way is probably a really helpful starting place. But thank you for talking us through that, Nikki. And I guess it's just to reiterate and just remind people that family liaison module is now on the Thrive London website. It's sitting alongside the other Gift of Reconnection training as well. So it's about 75 minutes in total. It's edited in the same way as the other series. So it's got the British Sign Language overlay as well for additional sort of accessibility if that's required. And I think one of the feedback that we get quite often, Nikki, actually, is just around I think how you and the team have developed that training in a way that's really accessible, but also it's a really clean edit. It's quite a really visual piece as well as you go through with some of the graphics that are used. And I think we have seen pop up over email people quite often saying they don't feel like they're watching something that's pre-recorded. Quite often they feel like they're coming to it and that it's just you and them in a room and they're watching that together, which I think is really, really impactful, and probably why we've seen this particular training the feedback and the numbers taking the Gift of Reconnection series. So hopefully, I think this is a really, really important module, as you've described, Nikki, and hopefully this will support many more people for this more specific role that they may have. But in terms of the sort of headline stats at the moment, so the Gift of Reconnection series, I think we launched that, catching myself out now, must have been beginning of 2023, something around then. And I think February 2023, we published that first bronze level training. And since that training's been launched, there's been around 29,500 views of all the collective. I don't know if someone's just able to go on mute in the background there. Sorry, I think I've done that. So yeah, sorry, just to reiterate, so the Gift of Reconnection series is on the website, and then across all the YouTube videos that we've got of the bronze, silver and gold levels, we're now over 29,500 views across that, which is phenomenal, really. It's brilliant. But to put that into maybe better context, that equates to 7,860 hours of viewing time, or 327 days. So I think it's a resource that's definitely continued to be needed, and the demand's there, and it's great that we're able to host that. And again, just to sort of the launch of that series was supported by the Mayor of London when we launched that in 2023. The family liaison module only went up last week, but already 125 people have taken that training, so we're starting to see those numbers sort of slowly increase, which is great. And I guess in many ways, Nikki, I suppose this sort of maybe leads me to a bit of a question from your perspective. I mean, in London, obviously, we've sort of developed that in London, but many more people outside are taking that, and that's great. And in many ways, it's great that we're able to host that for others, and as you say, provide that resource where it's a sort of framework and starting place for people to access it for free and so forth. But do you think there's maybe a step change? It's seeing those numbers increase as well, maybe in recent months. Do you reckon there's been a bit of a step change, maybe in perspective, or perhaps a greater acknowledgement about the importance of taking a more trauma-informed approach? And maybe that's why some of those numbers are continuing to grow.
Yes, I mean, I think certainly there's been a really significant shift in recent years about the importance of a trauma-informed approach, and I think that's cascaded into a whole range of other things, such as what commissioners are looking for, where funding might be contingent on organisations taking a trauma-informed approach to delivery of their services. But I guess in response to that, I would also just say that, as with anything that increases in popularity, it is also subjected to things like misunderstandings and misapplication. And so one of the things that we really tried to do with the Gift of Reconnection, I guess, was two things. Was to firstly make sure that it was absolutely accessible, so that organisations weren't having to pay out to keep on training people, that we could make sure that it was accessible free of charge, and that it was easy to access as well, with it being an on-demand resource. But the other thing that we really wanted to do was to simplify this concept, which was why we talked about it being about the gift of reconnection rather than trauma-informed practice. And ultimately to remind practitioners that what we're looking for when we talk about this trauma-informed practice is that capacity and willingness to be human. And that doesn't necessarily mean lots of changes to services and processes and how they're delivered, or the boundaries that they set out, or the scope of their work. But it's just about giving some consideration to how they're delivered and actually implemented, rather than necessarily needing to change whole organisations or whole systems. So I think it's a real balance when we talk about trauma-informed practice. I think it's wonderful that we're now starting to understand trauma in a way that we haven't previously, but we also need to stay very mindful that we don't want to misunderstand or misapply this idea of trauma-informed practice. And so to stay really true, I guess, to those 6 core principles, or to whichever framework you use around trauma-informed practice, but to think about what do they actually mean within practice, and how can they support practice, and also not to lose sight of organisations that might not necessarily be trauma-informed or know that they're being trauma-informed, and miss the great work that gets done across a whole range of organisations before trauma-informed practice gained in popularity. And so that's why I think for us it's wonderful to see the high numbers, and it's a real privilege that we've been able to make it freely accessible to a whole range of organisations, because I think that then means that we can support this idea of really simplifying the concept, not overcomplicating it, and looking at how it can support the work that's already been done, rather than necessarily having to change the work that's being done.
Yeah, no, I think that's a really interesting reflection actually on sort of how maybe this came about at a particular point when actually there's maybe a bit more awareness, but without really losing those principles. Because I think that's the key thing that comes through, even on the new training module as well, just a sort of reminder of those key principles for a trauma-informed approach. I guess within the sort of data and the numbers that we've seen take the training, I suppose maybe this leads into another slight angle of the question is I suppose, how do we maybe encourage other sectors beyond? We see a lot of education, we see a lot of NHS, local government come through, where maybe this is more apparent that this is a resource that would help them, but actually, as you've said, it's kind of a having a human connection. How do we get that point across to other sectors and maybe encourage them to participate where they might not think it's relevant for them because of that trauma-informed bit, if that makes sense?
Yeah, I guess what I would say is that I do feel that the training just simply is a useful reminder of the importance of kindness and compassion, and it reminds us that we are part of a wider social fabric, and with that comes responsibilities to each other, to ourselves, but also to each other. And we're in a world where we're becoming increasingly fragmented and disconnected post-pandemic. And so what I would say is there can never be enough reminders of this. So even if it's a practitioner or an organisation working in a different space, not necessarily working with beneficiaries who are vulnerable, but I just think it's quite a nice reminder that we are all part of the world, we are all connected, and that we all have a responsibility to to be kind to each other, to be compassionate, to be considerate, to find a way of being in the world alongside each other. And so I guess I hope that that's what comes through in the training. So even if somebody's just picking up, you know, that first bronze module and not necessarily progressing, I hope that it's a nice reminder of what it is that we're looking to do, and reminder of how we want to show up and be in the world, for ourselves and for each other as well.
No, I think that's really important. And the training itself, if you were to do bronze, silver, and gold, is about 5.5 hours or so. But as you say, actually just starting at that bronze place and sort of working your way through it over time, I think is really what we've seen actually, is people sort of request their certificates over, you know, a period of months, and actually just sort of taking their time going through that training. Because I guess one of the things we've sort of, you know, in the feedback is that actually people really want to take this training, but actually a lot of those people just don't have that time or extra capacity. So trying to support people in the way we have to sort of chunk it up and do it in a bite-sized way, I think has been quite popular as well. But people can approach the training in that way, really, can't they, Nikki? They can just come into it chapter by chapter and take it away and reflect on a little bit.
Yeah, absolutely. And I think it's, you know, it's designed to be a training in terms of developing knowledge and skills, but I think it's also just designed that somebody could listen to it and maybe hear something that resonates with them, or hear something that they think, no, that doesn't quite work, or that doesn't fit with the place where I work. And that's all we're really looking for, is that somebody might listen to the training, might engage with the training, and something might stay with them afterwards, rather than necessarily needing to go in and learn everything, and come away with a huge amount more knowledge. I think it can be both. It can be about generating knowledge, but it can also just be about presenting different ideas, and different ways of doing the work, some of which may work and some of which may not quite work for other people, but will it at the very least get them reflecting on their practice. So, you know, I hope that it does both for people.
And do you reckon it helps, I suppose, if people sort of take that training, sort of say individually, and then within an organization, as we get more towards that gold level, which talks a little bit more about organizational approaches, obviously maybe coming back together and spending a little bit of time to sort of reflect on that and go through?
Yes, I think there's certainly a space, certainly at the kind of the bronze and the silver level. It is very much about individual practice and thinking about individual impacts. And then I think at the gold level, anything that can be done to kind of bring people back into that system and think about how trauma shows up in systems and how we can navigate systems together becomes really important. I think one of the things that we are seeing time and time again when we get requests for training is that organisations are sending their frontline practitioners for trauma-informed practice training and not their senior leadership team, not their chief executives. And so the message that's being given is that you need to be trauma-informed in the delivery of your support, but we don't need to be trauma-informed in how we manage this system or in how we lead you. And that's something that we do struggle with when we're going out and delivering training, and actually something that we're now saying no to, that unless it's all levels of an organisation, it doesn't feel right to just say to frontline practitioners they need to be trauma informed. They need to be they can't be trauma informed unless they're working in a trauma informed system. So those distinctions start to become really apparent between the sort of silver and gold level. So I think anything that can be done between those two levels, and certainly at the gold level, to bring people back into thinking about where their role is within the system, but also what they need within that system as well in order to do that work, becomes really important. This is not an individual responsibility. This is a collective responsibility.
Yeah, and I think actually in September 23, actually a letter went out from the Marylanders office to senior leaders across what sort of deems that sort of public sector partnerships, so NHS, TfL, police, fire, etc., to make the case that, you know, the training is there and actually it is something that would really benefit from, you know, really senior level taking that training and encouraging that right through an organization, because the impact, actually the ripple effect impact over time would be phenomenal, really, if everyone had those sort of skills, as you say, even if it was to sort of take them and may not necessarily sort of think about them until such a point when actually, oh, it's the back of their mind, and they're approaching a conversation, they're approaching a situation in a slightly different way than they may have done otherwise, I suppose. But I think it's just been really interesting to unpick some of those bits, really, and just, I guess the training's been online for a little while now, just to sort of, this is probably the first opportunity we've had to maybe just sort of chat amongst others as well, just to sort of reflect on some of that. Maybe whilst people are thinking of the question, I'll pose one, maybe just to take that sort of prerogative, if I can right now, and just say what's on the future in terms of the future horizon for yourself, Nikki, and the team. What are there other specific modules you're thinking about? Are there other gaps that you've maybe spotted in terms of this space?
I think that's quite a tricky question in some respects. I think precisely because there is so much growth in the area of trauma-informed practice. And so because we're also working across a range of different areas, it can sometimes be quite sort of challenging to know what to prioritise in terms of what should come next. So what we do know is that there's still much more to be done in this traumatic bereavement space in particular, and we are really looking forward to working with yourselves to think about how we can promote and evaluate that training. And more broadly, we're also beginning to look at this idea of the misapplication of trauma-informed practice, knowing that this isn't of itself a barrier. So to think about how we can, how to give some clarity to its actual intent, to make sure that it stays a really valuable and effective framework for practice and perhaps doesn't get lost in terms of what it's actually intended to do. And I think, you know, on a personal note, I've recently returned to clinical practice in the NHS myself, and so that's been really interesting to see some of the real challenges when there's a lack of resources to maintaining and sort of sustaining this trauma-informed approach and the kind of constant reflection. And I think I do say this in the training quite a lot, but being trauma-informed isn't a place you get to, it's a place that you aspire to get to. And I think every day we try and be trauma-informed, but you know, with the best will in the world, you're constantly reflecting on practice and striving to be trauma-informed, striving to be kind and compassionate in practice. But there's usually a whole host of barriers to navigate and overcome. And I think now that I've returned to clinical practice, having taken a break during my PhD, I can really see some of the challenges that practitioners are up against. And so I guess it's helping me to understand that what we are looking for is that simplified kindness. Even when we get it wrong, as long as we're being kind, as long as we're saying sorry, as long as we're acknowledging and taking responsibility for those places where perhaps harm is caused rather than the comfort and support that we'd aimed for, then, you know, we are continuing to try and aspire to be trauma-informed. So I think that's given me a real insight into where does trauma-informed practice actually fit in practice, rather than just the kind of theoretical approaches that training would otherwise take to kind of developing knowledge, but really thinking about that gap between the theory and the knowledge. But what does that actually mean for practice, and what's realistic within practice? Because I think if we don't pay attention to that, then we're not going to be able to be trauma informed. And then there's a danger that practitioners and organisations will discard it as something that doesn't work for them, or as something that creates more work for them at a time when they're already struggling from a resource perspective. So it feels important to be going back into clinical practice and gaining some of those insights for myself firsthand as well.
Must be quite difficult to return and be putting yourself right into that clinical practice, but then also the mindset of thinking, oh, the gift of reconnection, I see how this might work in a full circle way, you know. Are you enjoying the return to clinical practice? Has it been a good transition?
I am, yes, I am. I think it's been really wonderful to go back and sort of be, I guess, frontline again. I think uncomfortable at times, because I can also see that some of the advice and some of the guidance that I'm delivering in the training, I can see where it's falling short of reality as well. And there, you know, there's some uncomfortable reflections for myself around things that I could have done differently, things I could have done better. But I am also seeing the value of working in a supportive team, of working with practitioners who still hold that mindset of we want to do our best. And so I'm seeing some really good practice within the NHS. I'm seeing some really challenging practice as well, and experiencing those challenges firsthand. But I think it's wonderful to be part of a team that still has that kind of value of kindness and compassion, and how can we do our best, and how can we do our best when we have very few resources available to us. So I think that feels like a really lovely thing to have returned to.
I think in a sense it may even emphasize that point around coming to this. Maybe you can take the training individually and pick up those principles, but actually the power is when you're coming together with others in that peer-to-peer space or setting, and really trying to strive, as you say, the ambition to be trauma-informed collectively in many ways.
Yeah.
Nikki, thanks so much for your time this morning. I'm just double checking. There's a thank you message from Caroline saying that the training's really helped in their role and to feel more trauma informed in their approach. So brilliant. Thank you for that feedback. And we genuinely really do invite feedback. And as Nikki mentioned, we're sort of opening there's a pre and post survey for the family liaison module, so do try and fill that in before you take the training and afterwards. And within there, there's the ask if people want to sort of come back at a later stage. We'll try and sort of get a bit more feedback and insight from people once you've had an opportunity to take the training, and then maybe reflect on that in your own practice. Just a last opportunity for anybody really, if there's any final questions or comments or anything for Nikki while we've got Nikki this morning. If not, obviously we'll put the details in to get in touch afterwards. It may be that there's maybe some specifics, and I did mention at the top for today's session we were talking in more general terms, so it could be that that's part of it. But if there isn't anything further, we'll start to wrap up really. Nikki, thanks so much for giving us your time this morning. I know how busy everything is, and as you say, that return to clinical practice on top as well, but just really grateful. And I think last week's launch was great to get a new module up, something I think that's going to have a real impact for people who take that training. And we can keep in touch with everybody around sort of that number. And I guess a message for myself really is do pass that on. A lot of this training is being passed through word of mouth. Actually, we haven't put any paid advertisement, if you like, into that. So I think again, there's the appetite and the demand is there. It's just pushing it out to people in your network so that they're aware of it as well. Nikki, any final thoughts from yourself before we finish?
No, just to say thank you. Thank you for people who've joined us, and for the feedback that's been given on the modules as well. And yeah, just to reiterate, very happy to be contacted, to try and keep up those connections with the people who are accessing the training. But no, just a thank you from me.